Hi, my name is Dr. Warren Fingrut, and I'm a Canadian hematologist and a fellow right now in adult bone marrow transplantation at Memorial Sloan Kettering Cancer Center in New York. I'm also director of Stem Cell Club, a donor recruitment organization in Canada that works to recruit Canadians as potential bone marrow or stem cell donors. My talk today is titled Virtual Recruitment Campaigns to Engage Specific Demographic Groups as Donors. There's marked racial disparity in access to unrelated donors for allogeneic stem cell transplantation. Allogeneic stem cell transplantation is a curative therapy for patients who have high risk or advanced hematologic malignancies, but it requires access to a suitable donor. And ethnic and racial minority groups, patients from ethnic and racial minority groups face marked disparity in access to unrelated donors with a significantly decreased likelihood of identifying a fully matched 8 out of 8 unrelated donor. You can see that in the graph on the right where, and this is data from Sloan Kettering, showing that Southern and non-Europeans have a less than 50% chance of securing a fully matched donor as compared to about 75% chance for folks of European ancestry, Northeast mixed European ancestry. And the seminal paper from New England Journal of Medicine from 2014 by Gregory et al. Found similar results with patients of Black ancestry as low as 16% probability of finding a matched unrelated donor versus over 75% chance of finding a matched unrelated donor for those folks of Northwest European ancestry. There are multiple factors that contribute to racial disparities in unrelated donor access, including poor representation on registries, and that's true on individual registries where ethnic racial minority groups are not well represented. And I show on the top right data from Canada showing that, and this is from 2017, showing that majority of the registry is white and the various other ethnic racial minority groups are not represented in proportion to their makeup of the Canadian population. But also, if you look worldwide, majority of donor registries are located in countries in the Western world and registries in Asia, in Africa. I mean, very few donors as compared to their makeup of the world are registered overall. There's also differences in genetic diversity between different ancestral groups. And the study by Beatty et al. From 1995 illustrated this beautifully. You can see that in the graph on the bottom right, where this was a modeling study that was done where additional donors were recruited to a theoretical registry. And it was shown that for every 500 new donors of African ancestry that were recruited, there was an increased number of new HLA haplotypes added to the registry as compared to folks of Caucasian ancestry or other ethnic groups. And so there are differences in the genetic diversity or the genetic heritage of different groups that can contribute to differences in probability of finding a match unrelated donor for those groups. There's also differences in attrition between groups with higher attrition in ethnic racial minority groups compared to those of Northwest European ancestry. And that can be for a multitude of reasons, including socioeconomic barriers to donation and cultural and religious and other factors, which present barriers for those groups in terms of going through with donation if asked. I founded Stem Cell Club back in 2011 to augment recruitment of young and diverse unrelated donors in Canada. This is an organization with teams of students based at university campuses across Canada that work to recruit donors at drives, virtual or in person. Before the pandemic, we had a capacity to recruit over 5,000 donors per year, all ages 17 to 35. Over 50% male, and over 55% were diverse or non-Caucasian ancestry, recruiting over 20,000 donors to date. And we also lead a community of practice in stem cell donor recruitment in Canada. This is a community where folks, all stakeholders in donor recruitment in Canada come together with a Facebook group as its online hub, and we have regular e-meetings as well. There's over 400 participants in our community, and we have subcommittees of the community which focus on national campaigns, on engaging the media, developing resources to support recruitment of ethnic racial minority groups. And I'll outline some of the resources that we've made to date as examples, we have an infographics committee that makes beautiful infographics highlighting information on how to sign up as a donor and materials which can be shared online. We have a multimedia team which develops whiteboard videos and other video resources, which we've evaluated, and we've shown improve the knowledge and attitudes towards donation for potential donors of diverse backgrounds. We have a story team, a Why We Swab initiative, a committee of donor recruiters that recruits and interviews potential storytellers, folks who are impacted by stem cell donation, so patients, donors, family members, transplant physicians, and writes up their story together with the storyteller in a format that's suitable for publication on social media. Our channels are available on Facebook, Instagram, and Twitter, Why We Swab, and we have over 25 stories to date, well over 100 posts. And similarly, we've shown that showing these stories to diverse potential donors, it improves the attitude towards donation compared to before they saw the stories. We also have, and since the start of the pandemic, embraced TikTok as a platform for donor recruitment. And in the first 6 months since the launch of our TikTok platform, we have developed over 150 TikToks with hundreds of thousands of views published by multiple Canadian media outlets. And we continue to develop additional TikToks over time. Stem Cell Club and the community of practice that we run has run a number of in-person campaigns. But then when the pandemic came, it forced us to reevaluate, to shift gears and develop approaches to recruit donors virtually. And it was decided that the community of practice realized, and we wanted to do right by our mandate to recruit diverse potential donors especially. And so we started running campaigns, virtual campaigns, aiming to recruit specific demographics of donors. And I'm going to tell you about some of those campaigns. So I'll start by telling you about a campaign that we ran this past February called Black Donors Save Lives, where, and I've shown this graph in the very beginning of my presentation, but Black peoples make up a small portion of Canadian Blood Services Stem Cell Registry, and they're not Black people are not well represented as donors in Canada as compared to the population, but also Black peoples are not well represented as donors worldwide. That is one factor that is impacting on the lower match rates for Black people as compared to folks of Northwest European ancestry. And so we aim to develop a campaign to get the word out to Black peoples in Canada, Black Canadians to engage them as potential donors. The community of practice was activated to develop an array of multimedia in collaboration with Black Canadians to raise awareness about racial disparity and access to donors, to educate about donation and encourage donation. And the resources were reviewed for accuracy by transplantation experts and for appeal by Black Canadians. I'm going to show you a few of these resources now. We developed infographics. The infographics committee developed these infographics using photos and pairing with facts and highlighting, again, data outlining the racial disparity in access, difference in match rates, and how to sign up as a donor. We told through our Why We Swab platforms the stories of recipients of stem cells who are Black people living in Canada. On the left is Dorothy's story, and she received a stem cell transplant for leukemia. On the right is Reve, and she received a stem cell transplant from her sister for sickle cell disease. And both stories highlight the impact that donors can have on patients in need of stem cell transplantation from this community, and appeal directly to the Black community in Canada to sign up as donors. We developed an array of engaging other multimedia, including videos and TikToks, and an original song. And I'll show you a few of these resources now.
Did you know that Black people make up less than 3% of stem cell donors in Canada? Somewhere in Canada, a Black life means you. We have the power to change so many lives we can save, and with the gifts that we have, we can change someone's fate. All the magic in our skin stems in the melanin. You could make a brighter day, a brighter day. If you share your stems today, your stems today, you could make a brighter day, a brighter day. If you share your stems today, your stems today.
We also have TikTok. Different kinds. This is a more recent one that was developed. We have procedure diagrams which feature Black people sitting in the donation chair donating stem cells and bone marrow. And we arrange these multimedia together on a campaign page on our website. And we partnered with local and national Black community groups, Black Physicians of Canada, BC Community Alliance, Black Medical Students Association, on-campus groups, and so on, to retweet, share, like, and post these resources over a 2-week period during Black History Month in February. The campaign was covered in over 10 media outlets across Canada. Multimedia that we developed for this campaign in collaboration with Black Canadians and performers who are Black in Canada were republished by media multiple times, as shown here. And for future work in relation to this campaign, as we're going to be assessing the impact of this campaign on the recruitment of Black Canadians, we're conducting focus groups which are ongoing with Black Canadians to secure their feedback on this campaign, learn their perspective, and guide how we can improve it over time. And also to evaluate the resources on, in terms of their impact on the knowledge and attitudes towards donation of Black people living in Canada. And we'll be improving our campaign based on these data. I'll tell you about a second virtual campaign that we ran this past Pride Month. And the background to this campaign is that since 2009, gay, bi, queer, and other heterosexual men in Canada have been eligible to donate stem cells, though many from this community are not aware of their eligibility to donate, in part because of restrictions in relation to blood donation, where in Canada right now, men of sex with men are not able to donate blood unless they have abstained from sex for a period of 3 months' time. And we hypothesized that targeted recruitment of men of sex with men, gay, bi, queer, and other such men, could augment efforts to recruit the most needed stem cell donors and support a more inclusive donor registry. And this work was based on a series of drives that we ran, a pilot campaign at Pride events in person before the pandemic in 2018 and 2019 across Canada, where a series of recruiters from stem cell clubs staffed stem cell drives at Pride festivals. And we recruited hundreds of potential donors, many of whom were gay, bi, queer, and other men of sex with men. And the feedback was overwhelmingly very positive from our recruiters, that efforts to engage this population as donors were well received, and an important channel to recruit potentially or to recruit potential diverse donors that may not be aware of their eligibility to donate. And so we activated the community of practice again to develop an array of multimedia in collaboration with gay, bisexual, and queer men in Canada, designing to reduce stigma in relation to donation from men of sex with men, to highlight this demographics eligibility to be donors, and again, to educate about stem cell donation and about the awareness, increasing awareness for the need for diverse donors. And the resources themselves were reviewed for, again, accuracy by transplantation experts and for appeal by gay, bi, and queer men in Canada. And so I'll show you some of these resources that we've made. And the first I'll show you is an infographic set, a set of infographics that we developed. The left, more information heavy, outlining the eligibility of men of sex with men to register as donors, outlining the need for diverse donors, and then focusing on the eligibility criteria, with special mention also that people living well with HIV, who have an undetectable viral load, still may be in excellent health, but are not eligible to donate stem cells because it's not known that if HIV is undetectable in blood, is it also undetectable in bone marrow stem cells? And we highlight also that patients undergoing stem cell transplantation are immunocompromised and would be at much higher risk of HIV complications than other people. This particular text summary was workshopped with many gay, bi, and queer men, including some who have a history of HIV or who work with patients who have HIV, to guide the phrasing to avoid stigmatizing this population or members of this population who may be healthy but also HIV positive, and making them aware of the eligibility criteria in a sensitive and respectful way. And then on the right, you can see an infographic, again, highlighting the eligibility of men of sex with men to be stem cell donors. We have our Why We Swab committee developed and shared an array of stories in relation to gay, bi, and queer men and stem cell donation. On the left, you can see a segment from Susan Doherty's story. She's a Canadian patient, a recipient of stem cells from William Ashby Hall, a gay man who was an unrelated donor, and then she went on to meet him 2 years later. He saved her life. She had a rare autoimmune disease called HLH. And she went on to meet him and his partner, his husband. And it's a beautiful story, which we share, featuring and highlighting that not only can gay, bi, queer, and other men who have sex with men donate stem cells, but they have, and they've saved lives. On the right is the story of Joel, and he's a stem cell recipient of Indigenous ancestry and is also a gay man, and shares of his experience from diagnosis through to transplant and meeting his unrelated donor. In the first segment of his story, he talks about how when he was first feeling unwell and had leukemia but didn't know it, he saw his doctor and got a phone call from his doctor who said that there was a problem with his blood work and he needed to come in. And his first thought was, quote, "Is it HIV? As a gay man, this was my first thought," he said. And the doctor said, "No, it has to do with your bone marrow." And we workshopped this story. We showed it to many gay, bi, and queer men in our networks and in focus groups. And they shared that this was a story that they identified, an experience that they identified with. It would be a worry that many gay men would have, they explained to us. And so they connected with this story. We developed, in collaboration with queer performers across Canada, an array of engaging multimedia. And I'll share some of these multimedia with you right now.
Did you know that gay men can donate life-saving stem cells regardless of recent sexual contact?
Huh? Really? What? I had no idea.
Well, neither did I. Many patients with blood diseases need a stem cell transplant to get better. These patients have diseases that impact their blood cells. When they get a transplant, the donor's stem cells act as new factories, creating the blood cells the patient needs.
That's awesome!
Awesome, indeed. However, for the stem cell transplant to work, the patient and the donor have to be a match.
And a match is really hard to find.
And since patients are more likely to match a donor from within their own ethnic group, it is especially important for everyone, including Indigenous people and people of color, to sign up.
To register as a stem cell donor, or for more information, click the link below.
And also, we've developed a series of TikToks, and these are uploaded to YouTube, but I'll share them with you here, but they're also on TikTok.
Did you know gay, bisexual, and queer men in Canada are eligible to register as stem cell donors regardless of who they have sex with? That means you can help save a life regardless of who may be in your bed, or on your couch, in the back seat. Watch part 2 for more, or check the link in the bio. So, what makes you eligible to register as a stem cell donor? Good general health, between the ages of 17 and 35, and willing to be a donor. You're set. That means gay, bisexual, and queer men in Canada are eligible to register. Even this whale is eligible to register to potentially save a life. Watch part 3 for more, or check the link in the bio. I've been receiving whale calls and echolocation messages that there is currently a lack of diversity in the stem cell registry. Patients are more likely to match from someone with the same background. For example, even though we're all whales, this blue whale's stem cells may not work for belugas and narwhals. Watch part 4 for more, or check the link in the bio. Ready for the show? Finished flipping my fins and ready to become a stem cell donor. It's so easy. You can complete the swab kit at any point of your day. Gay, bi, queer, no matter who you have sex with or how much makeup you wear, you may be eligible to register as a stem cell donor. For something that could save a life, you wouldn't think it'd be as easy as doing a whale call.
And so we have actually a whole array of videos like this. And for the sake of time, I've just shown you these two, which are really high quality.
Hi, my name is Ivan Bocanegra. I'm 24 years old. I'm originally from Mexico. Now I'm currently
And our campaign also includes, and the video was playing the next video in the series, it includes testimonials from gay, bi, and queer men across Canada in support of their community to sign up as donors. On the left, you can see Tyson Cook, also Free to Wales, the performer that you saw in the recent TikToks that were ongoing. Quote, "I support this campaign because I think it's important to get the message out to as many queer men as possible that they are allowed to donate stem cells. If a gay, bi, or queer man were to donate stem cells and save a life, that would just be fabulous." And on the right, from Ivan Bocanegra, another performer at campaign, whose videos you haven't seen yet, but are available on our YouTube channel. Quote, "I think that gay, bi, and queer men who donate stem cells to save patients' lives, I think of them as heroes. I encourage them to sign up because I know a lot of people are not well known of this topic." Through our focus groups with members of gay, bi, and queer men, male communities across Canada, we identified an additional barrier with respect to donation. We found that many monosex men in Canada were worried about how they'd be treated by the healthcare system as donors. Quote, "I'm curious what the overall experience would be like navigating the healthcare system as a gay man and self-disclosing that. What would one face? Some form of discrimination?" Or from another focus group that we ran, quote, "Stigma is a concern. If I were to announce that I identify as a man or sex with men and wish to donate, I'm unclear how that would be perceived by the technician or whoever's doing the intake process. Would they treat me differently compared to another donor?" And based on this feedback, we solicited transplant physicians across Canada to make video statements in support of gay men, bi men, queer men to donate stem cells, recognizing them as heroes, reassuring them that they'll be treated with dignity and respect. And so on the left, you can see there's a QR code, and all these videos are again available on our YouTube channel, but for the sake of time, I won't play them. But this is a video that we've made that we've asked and that Dr. David Allen from the Ottawa Hospital made. And he says, quote, "I also want to reassure and emphasize that the collection teams at our specialized collection centers will treat donors with the highest levels of respect and courtesy, indeed as heroes of their unselfish gift that can truly save a life." And on the right, a statement from Dr. Arjunlaw from Princess Margaret Hospital in Toronto, quote, "Race, background, nationality, sexual orientation, gender identity, stem cells look the same no matter where they come from." We developed all of these resources into one website, a campaign page, Saving Lives with Pride, which is available at our website, stemcellclub.ca. And we ran a national campaign this past Pride, which was disseminated, again, locally and nationally in collaboration with LGBTQ groups and their networks, including Canadian Queer Medical Students Association and various on-campus Pride societies and grassroots community groups as well. And the campaign was covered nationally. And ongoing work is similar to Black Donors Save Lives. We're running focus groups to evaluate the campaign materials in terms of how potential donors from those demographic groups feel about these resources in more detail and how they can be improved over time. And we're also generating some feedback in terms of, or we're quantitatively assessing, the impact of these resources on the knowledge and attitudes towards stem cell donation. And on specific barriers to donation for monosex men. Now, using these campaigns as templates, which have been very successful and high impact, achieving significant media coverage and putting together significant high quality resources, we're going to be following that template to run a whole set of campaigns next year that are in development, including South Asian Donors Save Lives, which will run during Diwali in November, Korean Donors Save Lives, which will run during Korean New Year in January, Chinese Donors Save Lives, Persian Donors Save Lives, Indigenous Donors Save Lives, and again, we'll reprise Saving Lives with Pride and Black Donors Save Lives. And based on our experience so far, I'll share now 10 tips for running successful virtual recruitment campaigns focused to engage specific demographics of donors. The first is that you have to select a group of needed donors to engage. And so in the case of stem cell donation, that would be selecting a community of people who are young, diverse, and there's a need for male donors as well. But depending on the product that you're seeking folks to donate, the demographic group may be different. Build a network of individuals and organizations with whom to collaborate. In the case of Black Donors Save Lives, that was with building relationships with Black community groups, with Black performers, and similarly with Saving Lives with Pride campaign that we ran, with building relationships with queer people, queer performers, and organizations, Pride organizations across Canada. Identify barriers facing that particular demographic group to register and donate, and that can be achieved through focus groups, through reaching out to and working together with the organizations and individuals that you've connected with to identify what are some of the barriers that prevent folks from that particular group from signing up. Is it just that they don't know about the opportunity, or are there things that need to be addressed in the multimedia that you will develop together ahead to improve the chance, or to get to the bottom and address how we can get folks from that particular group to register as donors. Collaborate with members of the demographic group to develop engaging multimedia to educate about donation and address barriers to donation. One of the strengths of the campaigns that we've run so far is that they included an array of diverse and engaging and high quality multimedia, including stories from patients, including TikToks, including longer high quality videos to deliver the information in an engaging format across social media, which is a format that allows for the dissemination of information virtually. Invite members of the demographic group to review and approve the materials and overall campaign plan. This was something that we employed in our campaigns, and it's very important to work very closely with members of that demographic group to guide you and to review and approve and make any changes as needed to the resources that you develop to make sure that they have the highest impact and are, from an equity and diversity inclusion perspective, that they meet the standards that to be shared with that community. Run the campaign during a period of significance for that demographic. And so in the case of Black Donors Save Lives, we ran that during Black History Month. In the case of Saving Lives with Pride, we ran that during the Pride Parade. And we're running a whole set of campaigns next year focused on particular ethnic, racial, demographic groups during periods of significant times for that demographic. Secure partners at the local, grassroots, national, regional levels to disseminate the resources that you develop across networks. And I think it's very high impact to develop a campaign and then have that campaign available and the resources available for the individual partner groups to share it on their channels. And the highest yield is to have them, to make it easy enough to access the resources that such groups can come across and share the resources organically. Engage the media to the campaign. So that involves developing and sharing a compelling press release to let the media know about the collection of resources that were developed and that they're being shared at a particular time for a particular purpose to help save lives or collect a particular product of need. And evaluate the impact of the campaign. I think it's very important to guide improvement to see how you did, how did you do in terms of donor recruitment, what was the impact of the resources, how can the campaign be improved according to focus groups of donors from the particular demographic of interest, and improve based on that feedback and repeat. I'm going to end there. I want to thank my supporters, collaborators with Canadian Blood Services, all of the performers in all of the multimedia and the folks that helped with our virtual campaigns, and all the members of the community of practice in stem cell donor recruitment in Canada and with Stem Cell Club, including those who develop our TikToks and multimedia and our Why We Swab story library, and the transplant hematologists that we partnered with too. Thank you so much.